This is a guide for healthcare professionals to take you step by step through the process of telling relatives by telephone about the death of a patient from COVID-19. There are 7 steps and advice if the patient has children in their family. This video is supported by 2 written guides, one for you as a healthcare professional and one for the relative to help them tell any children in the family. First, prepare yourself. Take a few slow, deep breaths to help you focus. Check the patient's information. What's their name? Do you know if they had children or a partner? If you can, relatives have found it helpful to know the name of who was with their loved one towards the end of their life. Check the latest protocol for when a patient has died and what bereavement support is available. You could practice what you're going to say with a colleague. Find a space where you won't be interrupted. Pass your bleep or phone to a colleague, and if possible, use a landline. Step 2. Starting the phone call. If the person does not answer the phone, do not leave a voicemail. If they do answer, introduce yourself by name. Clearly explain which team and hospital you're calling from and establish who you're speaking to. Check that they can talk privately. Speak slowly. Counting to 3 in your head can help slow you down, particularly if you're feeling nervous. If the person is very distressed, they may ask straight away if their relative has died, but don't rush into it. Just continue to the next step, the warning shots, which prepare the person for the news. Set the context for the call. I'm calling to talk about John. What have you been told so far about his condition? Is there anyone else you want to be in on the call? Step 4. Giving the information. Talk slowly and honestly. Avoid euphemisms like passed away, and don't use any technical or medical jargon. You might say something like, I'm sorry to tell you that John became very unwell and died earlier today. I'm so sorry to give you this news over the phone. After you've told the person that the patient has died, stop for a few seconds to allow the person to take in what you've said. Listen for reactions to gauge when they're ready for more information. Remember that pauses are important, as you can't see the other person's reaction to what you're saying. Step 5 is about managing the emotional impact of the news. Do what you can to support the person. People's reaction will vary. They may cry, shout, or go quiet. Just stay calmly on the line and don't feel you have to fill the silences. You might say something like, I understand this is very difficult for you to take in. Remember that distress may limit their capacity to absorb information. It is difficult to know how a person is reacting when you can't see them. It is possible they're trying to minimize their reaction because other people are in earshot. Use sounds and words like, take your time, I'm still here. This replaces eye contact or touch and confirms your presence. The next step is to establish if the patient was a parent or grandparent. If they were, ask for the names and approximate ages of the children. If the children are under 25, you'll need to discuss with the person how to inform those children. We'll go through this at the end. The last step is to make a plan. Explain what will happen next regarding death certification, mortuary processes, and personal possessions. Reassure them they will not have to manage this alone. Direct them to the appropriate bereavement services and online resources. There's been a lot to take in. Is there anything you don't understand? Repeat your name and which department you're calling from. Once the call is over, update the patient file and tell other staff that the next of kin have been told. These are emotionally exhausting conversations. Take a minute to check how you're feeling. Take a break, have a cup of tea, or talk to a colleague. If the patient had children, you'll need to give the family guidance on telling the children of their parent or grandparent's death. These are daunting conversations, and people don't want to upset children, but children need to know what has happened. In lockdown situations, families will have very little privacy and preparation time, so it's important for you to help the person with simple steps to prepare themselves, practically and emotionally, for the conversation with their children. The document, How to Tell Children, covers these steps in more detail. Step A. Preparing the family practically and emotionally. Talk to them about the children's awareness of what has been going on. Remind them that even very young children will have noticed that adults are upset and distracted and will be looking for explanations. Plan where they think the conversation should happen, whether it should be several children together or one at a time. Can the younger ones be distracted by the TV or a toy while you tell the older ones? If parents are separated, confirm who will tell the children and encourage consistent messaging to avoid confusion. Step B. Telling the children. Regarding the conversation itself, encourage them to speak slowly and pause so that the children can take in the information. Silences are okay. Euphemisms like passed away or gone to sleep can cause confusion and should be avoided. Help them think about what reactions to expect. Shouting, crying, or going quiet are all common. Younger children might focus on practicalities or not show any reaction at all. They may need to repeat the conversation several times. This is normal. Reassure the relative that it's okay to share their feelings with children, but best not to overshare extreme emotions. Step C. Preparing for common questions. They should ask the children if they have any questions about what has happened, or what will happen next. Children often want to know what caused the death, and worry they were to blame in some way. It's important to emphasise that it was nobody's fault. The patient had coronavirus, and they were cared for by the medical team, who did everything they could to look after their loved one. Other common questions include, is anyone else in the family going to die? Am I going to die? Who will look after me? And will I catch it? Focus on practical information and steps everyone is taking to stop the spread of the coronavirus, for example, washing hands and physical distancing. Relatives should reassure the children that they're not alone. We will work through this together as a family, whatever happens. Here's a summary of all the steps we've covered. On behalf of us all, thank you for your dedicated service in these difficult times.